Hi, I'm Hannah, and today I'm going to explain to you the surgery that you're going to have, which is Mohs surgery. And basically, one thing that you need to know is that it is for skin cancer, and it is brand new technology. And essentially, it is going to remove the skin cancer, but spare you as much normal tissue as possible. It's a treatment for non-melanoma skin cancers, and that means that the skin cancer is malignant, or it's a bad tumor that can possibly spread. And a couple of examples are basal cell carcinoma and squamous cell carcinoma. Basal cell carcinoma is the most common skin cancer, and it affects the basal cells, and those replace old dead skin cells in the dermal tissue. And the other type is the squamous cell carcinoma, and that is caused by abnormal growth rate of squamous cells. So both are caused by an excessive amount of sun exposure, and they can cause disfigurations. The Mohs surgery is performed by a Mohs surgeon specialist, and they are usually accompanied by a histotechnician, and he is the guy who's going to prepare the slides for the microscope, so the surgeon can look at the slides and determine if more layers of dermal tissue need to be removed, or if they can go ahead and cease the surgery because there's no longer any more cancer cells that can be visible. And he will also be assisted by an assisting nurse. The surgeon will use a scalpel, and it's a small, sharp, and sometimes detachable blade, and he will extract very, very thin layers one at a time from the skin cancer site. And like I said, once they look under the microscope and skin cancer cells are no longer visible, then they can stop the surgery. So that means that the surgery can take basically 1 to 3 hours, just depending on how deep the carcinoma is in the dermal layers of the tissue. The risk of scarring can increase if you do not do exactly, if we don't do the aftercare or surgery instructions that have been given to you. So, for example, you'll need to keep the bandage on your face or wherever the wound is. You'll need to keep it on for a good 24 hours, and then you can take it off, and then you can clean the wound site with just some mild soap and some warm water, and then once again rebandage it and keep the bandage on until we can remove the sutures. And usually for the post-surgery date, it'll be within 1 to 2 weeks after surgery, and that'll ensure that the skin has started to heal and it no longer needs the sutures.